This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on 9TV.
Integrating good oral health habits early on in a child's life will reap good benefits when they reach adulthood. According to the Department of Health or DOH, 87.4% of Filipinos are suffering from tooth decay, with 9 out of every 10 Filipino children dealing with tooth decay and cavities. However, oral health is not just about flashing your pearly whites. It can actually affect your overall health. This is the reason why dentists recommend that individuals visit the dentist at least twice a year, and that parents help establish a daily routine for their children as early on in life as possible. At what age should your child first visit the dentist? What type of toothbrush should your child use? Find out the answers tonight on MedTalk.
Joining us tonight is Dr. Georgina Roa Remulla. She's the past president of the Philippine Pediatric Dental Society, Incorporated. She's also the training director of the Advanced Education in Pediatric Dentistry at the Pediatric Dentistry Center, Philippines. Also joining us tonight is Dr. Fina Lopez. She's a consultant at the Pediatric Dentistry Center, Philippines. Both our doctors are from the Fe del Mundo Medical Center. You may join in the discussion by calling our hotline at 548-4678. Good evening, Dr. Fina. Welcome to MedTalk.
Hello, good evening. Thank you for having us.
First, I'd like to know if there is a difference in family dentistry and pediatric dentistry.
Yes, there is. Pediatric dentists take a minimum of 24 months after graduating dental school just to specialize in the field of pediatric dentistry. So minimum of 24, usually it can go until 36 months. And different is that we have hospital dentistry, and so we work closely with the hospitals, and everything that a pediatric dentist learns in their specialty training is really more focused on the kids, the younger group.
Okay, since tonight's topic is going to be more focused on the younger group, the kids, when is the best time to bring them to the dentist, Doc Fina?
Usually we want to see the children before they turn 1. So before their first birthday, we'd like to see the children so they can teach the mothers how to brush their teeth, the tips on diet, the best food to give, the timing also of the food, because sometimes the bottle is left in the mouth the whole night, those kinds of things, and what to watch out for. And we'd like to see the children every 6 months thereafter.
Every 6 months. Does the child have their first tooth during the 6th month, or earlier, or at a later time?
The average is 6 months, but I'd like to add with Fina is bringing them to the dentist earlier before any problems would make them appreciate and be better patients, and they're not afraid of dentists, because most of Filipinos or everyone around the world are really more afraid of the dentist because they come when there's a problem already. Okay. So seeing them when they're young can help develop their attitude towards the dentist.
A positive attitude towards.
So it's for them, it's more fun then.
And a good relationship with your dentist, no, that's very important.
Yes.
So there's no fear when you think of going to the dentist. You think of it as a fun activity for the
it's something
children.
like a regular checkup.
And it's usually an activity that has been established in childhood. They'll bring it up to adulthood, and it's something they can pass on to their children as well.
Okay. So when do they normally have their first tooth? Let's continue with
6 months is
Okay.
average, but sometimes you have it 6 to 8 months, and usually it's the lower teeth that comes first. It's the timing is usually lower teeth and then upper teeth. So 6 months all the way till before 3 years old, then you'll have all your 20 baby teeth already. There's certain months teeth will appear, so they don't all come at the same time. There's a little bit of a couple of months, give or take, before the one tooth will come out. So there's a range.
So the first tooth is normally the lower?
Yes,
It
lower
comes out
front.
in the lower front?
Yeah.
Okay. And they're not sabay?
Most of the time they are. Lower front, and then upper front, and then side, and then lower, and then upper, lower, and upper.
Until 2.5.
And everything is out already?
Yes.
Okay. I remember my mom was telling me that she'd get a cotton swab. Do you still practice that cotton swab and massage the teeth because it's uncomfortable at that age, no? 6 months, you're teething.
Yeah.
And so many things are going on inside your mouth.
Probably better than a cotton swab, because then when the cotton kind of like gets
Freeze.
wet,
How old
it's
school
freeze.
naman yan?
Yeah.
how do you do it now?
First the gums. You know, when there are no teeth, you still should start already by cleaning the gums. You know, just with water and probably a bib or a little washcloth to just massage and clean the gums. And as soon as the teeth appear, you can actually use a tiny toothbrush. You know, I don't really advise so much of the gum brush, because then, you know, these are teeth that need to be cleaned. They're solid structures that need to be cleaned. So you can use the gum brush for the gums, but a bristled toothbrush for the teeth.
What's the importance of the gum brush, or massaging your gums, or taking good care of the tooth rather, during the first 6 months?
Well, the first 6 months before the teeth come in, it's just basically to keep the area clean. And
Does it stimulate the tooth to come out?
Not necessarily. But at least the child is used to having the mouth clean. You know, it's already developing. So they're not going to be hesitant once you start brushing or, you know, taking more time cleaning the oral cavity.
So it forms the habit already,
Yes.
no? Kasi we were talking off cam, and we were talking about the habits that the child must form, or that the mother must instill in their child, no? So that when they grow up to adulthood, they won't encounter any problems.
Because we receive also so many parents saying, he doesn't like to brush his teeth. So they don't force the child anymore to brush. So, but you force your children when they don't want to take a bath, right? But why don't you force your children when they don't want to brush their teeth?
Yeah, you force your children when they don't want to eat.
Exactly.
Diba? They don't want to maybe interact with others, or they don't want to go to school.
They always say they cry. Your children crying is expression. You know, their language development. They're still developing words. They're still trying to, you know, imbibe more words to express themselves. So crying is, you know, natural. So it doesn't necessarily mean when they're crying, they're in pain, or, you know, they may just be upset, or, you know, they want something, but not necessarily, okay, crying, stop everything.
You can't kasi if you don't instill that early on, hindi nila yan maalala when they're older na.
Yes.
Doctors, let's talk about the stages of tooth eruption. We talked about 6 months. When they're 6 months, the first tooth comes out. How about between that period, 6 to 12 months? What happens to a child? What are the signs that a mother should watch out for, or parents should watch out for?
Well, again, as Dr. Georgia mentioned earlier, 6 to 12 months is the time that the tooth comes out. Average is 6 months. It can be as early as 4 months. It can be as late as 12 months. Some parents are alarmed that my daughter's turning
right
1.
away.
My daughter's turning 1. There's
Talaga?
no teeth yet. But it can be late. Don't worry, they're there.
Okay.
Not unless they have some syndrome, but they're there, and it will come out. And usually we want it the later the better.
Why is that? The later the better.
Para
Parents are not afraid to go in and
okay.
you know, brush. You know,
Okay.
they're bigger.
They're
You know,
bigger, yeah.
The child is bigger, so because when they come out, like for example, when teeth come out early, like 4 months, 5, the child is still the infant is really tiny, and parents are afraid they might poke something or hit something, so they just don't touch it.
Okay.
And then, you know, as long as there's teeth, cavities can develop. So can't really wait.
Okay. After 6 to 12 months, what's the next stage of tooth eruption, Doc Fina?
Yeah, well, it will go on, come out until they come out all 20 teeth until 2.5 years old.
Okay.
2.5 to 3 years old, and then it stops. Then the permanent teeth comes out much later at about. It will start coming out at 6 years old. There.
You have more permanent teeth than baby teeth. So some permanent teeth come in when all the baby teeth are still there. Not necessarily, you know, all your baby teeth are replaced, but you have also more teeth, permanent teeth that come out behind the baby teeth.
Okay.
Yeah, so there's a stage that the permanent teeth and the baby teeth are together, and it's what we call the mixed dentition stage. That's why we gotta take care that the baby teeth are good, so then when the permanent comes out, and they're all together there in the mouth, and they're all clean.
Okay. And that this
Healthy,
clean and healthy. Clean and healthy, you have to
Yes.
keep brushing their teeth during that time, no? So that it's cavity free. Can you get cavities at that age already?
Yes.
You've mentioned, no, basta there are
teeth,
there are
you can
teeth,
get
you can
cavities.
get cavities.
So cavities will not wait until the child is more cooperative. That's why you have dentists that do specialize in children, because basically pediatric dentists, they do everything a family dentist would do, but more emphasis on behavior, because you know the children will not just sit and open their mouths. So it's really behavior management to get the child to cope with the dental procedures.
You know, sometimes it's a problem also with the Filipinos, no? They think baby teeth lang yan, okay lang yan, mapapalitan din yan.
Oo, mahuhulog din yan. It's
They'll be
okay.
replaced. That's right, but you know, but the moment, the time that they're there, we need to take care of them. Because there's a time that the baby teeth and the permanent teeth are all together, and the mouth really needs to be healthy for the permanent teeth to also be healthy.
How do you take care of the baby teeth and the permanent teeth? What are the steps?
It's the same. Toothbrushing is our cornerstone. Yeah, toothbrushing with fluoride, the right amount of fluoride is what we need.
Okay.
Twice a day.
Even as an infant, the infant needs fluoride.
Yes. More so because the teeth are young and it needs fluoride deposited there. But we want only a very small amount of toothpaste. Yes.
Depending on their age, no?
Depending on their
Is that
age.
correct?
Yes.
When you start, you just do a little smear, and then when they hit like 2, then a little bit more, like a half a pea size. By the time they hit 3, more of a bigger dose. But you really don't need to use the whole strip or put toothpaste in the whole strip of the toothbrush. That's too much. So you just need the right amount of the correct amount of fluoride, of the correct concentration of fluoride.
And we actually advise no rinsing, no water
just-
rinsing after toothbrushing, because you're just throwing out all the fluoride. We want it there for it to work.
Yeah, and then you can just wipe it out, or because the child's too young to spit it out.
Yes.
just-
So it's okay
just wipe it out.
to for the child to
Leave the toothpaste.
Yeah,
but
swallow. It's just a
yeah,
tad
because
bit
then
time.
just think of they're swallowing half of what you give. So if they're young, then you only give a smear, and even if they swallow half of that, yeah, it's still within the safe dose anyway. So they're okay.
Okay. You wanted to add something to that, Dr. Not really.
No, not really.
Okay. Me, I want to add something. I've been looking at your what do you call this?
Tooth model.
Tooth model. I'm sure our viewers would like to know how to brush, the proper way of brushing their baby teeth. But we will take a short break. When we get back, you will teach us how to brush our children's teeth properly.
All right.
When MedTalk returns.
Do you want to have a healthier and more productive life? It all starts with good oral health. Studies suggest that excessive dental distress often leads to a variety of health problems, such as sinusitis, migraine, and even some sleeping disorders.
We're We're back here on MedTalk, still talking about child dental health. Doctors, before you do your demo, Doc Fina,
Yes.
Doc Georgia, what is the prevalence of tooth decay among Filipino children?
The latest is still very high. 97% of Filipino children have tooth decay. So we're almost number one in the entire world. So very, very high. And the thing is, dental caries is a preventable disease. So, with the right knowledge and know-how, you shouldn't even get dental caries, really.
That's a high statistic, no? That's a high percentage of Filipino children having tooth problems or tooth decay. Cavities is number one.
Cavities is number
Dental
one.
caries and tooth decay cavities are all the same, no? But I think the reason why it's very high, now we're discussing dental caries to be a disease model because it's caused by bacteria. Then we know that bacteria multiplies, bacteria transfers.
Love staying inside your mouth.
Yeah, and they can transfer from one child to the other, from one tooth to the other, from one child to the other.
So
and from
nakakahawa, you're saying?
Yes, it's an infectious disease. You can say it's the same as TB or any other infectious disease. It's bacterial in origin, and it can be passed on from parent. Most of the time, it's parent to child or from caregiver to child because they share saliva, they share spoons, they share, feeding. They blow on the food and feed it to the child. So that's where you can pass the bacteria.
Or child to child, sharing baon in school.
Yeah,
is that-
that's
Could
possible.
be, but more really from parental and caregivers.
Yeah, the most vulnerable age is from birth to 18 months, and that's when they're at home. Right?
And that's when the teeth are starting to come in.
out.
Right, right. So the teeth are starting to come out. We want proper dental care. How do we do it?
All right. As I said, toothbrushing is the first cornerstone, right? Our cornerstone in oral hygiene. This is a model of all 20 teeth. This is usually at 2.5, all the children have this much.
Already.
Okay,
How many again?
20. Then the normal adult teeth has 32. Okay. And so this is 20. Usually for a 2.5 child, we like to brush all the surfaces. That's the, I think, most basic. But we need it to be, you need to brush longer. There's a statistic in the States that say the average toothbrushing is about 20
average to
20 to 30 seconds. But actually, you should be brushing 2 minutes. Okay. But for a child, maybe that's too long because you have less teeth. But when you have all your 20 teeth, they still advocate the 2-minute brushing. Yes. Meaning 30 seconds, 30 seconds, 30 seconds, 30 seconds. So per side. Usually when you're looking, okay, this is a sample. And let's say that I have a toothbrush here. This is an electric toothbrush, by the way, but let's say we'll do it manually. Usually we want it in circles.
Okay.
Okay. And usually when we brush the teeth, for a child especially, we want to distract them. Kasi syempre nakakainip, diba?
Oo.
So we distract them.
So how?
With anything, a
sing,
song, yes.
Yeah.
You sing Twinkle Twinkle Little Star 4 times,
Yeah.
or
You just talk to them.
you
just say,
talk to
okay,
them.
This is what's,
But there are toothbrushing apps on the phone or on TV.
that's a timer.
It's a timer, a toothbrush timer. So you do 30
Nice.
seconds here, circles, 30 seconds here, and here also. But you should also do this. Okay, here.
On the chewing
On
surface,
the chewing
and then on the back.
on all surfaces also. So usually we do it per side na lang para it's not, there's a system. And the tongue.
Yeah.
Don't neglect
There's,
it.
there's,
Okay.
there's 5 surfaces to a tooth, so you want to be able to get to all 5 surfaces.
Okay.
Um,
No wonder it's 2 minutes.
Yes.
it takes
Yes.
long.
And for a child, we usually want to brush their teeth on a knee-to-knee position.
Yeah.
Usually
Or
on
probably
lap, yeah.
what would be easier if it's hard to describe a knee to knee, but they can be lying down on the bed. So the parent or the caregiver would be on the head part, and then they can, the child, they can just lift the lip and get in there slowly. So they can, their strokes and the amount of pressure they do to brush is more regulated because they can see where they're going. And your goal for brushing is to remove all the plaque that develops every day. So you're not just brushing, you have to really remove all the dirt. So you have to see where you're going. And the best is the child is lying down, and you can use your finger to lift the lip to see all the whole tooth, and then you can brush the gums na rin. So thoroughness is important.
Up to what age should the child be lying down on the caregiver's lap?
Until about
Mga what, 3?
6.
What naman 3? When they're 4 years old, stand up and brush your teeth.
Really, you want supervised brushing till the
Okay.
child is about even 7 or 8, because supervised doesn't necessarily mean when they're older, like 5 or so, you're brushing their teeth for them, but you're watching them, and the parent will kind of check and see if everything is clean, because brushing is dexterity. So it's like writing. If you can't write in script, then it's harder to keep your hand up to brush the gums and the top surfaces of the teeth. So it goes hand in hand with dexterity. That's why we want more supervised brushing. And kids will just brush 1, 2, 3, 4.
Yeah, I'm done.
And then that's it. As long as they feel that there's toothpaste in there, they feel the bristles, and then they're done. So it's not really a thorough, efficient way of brushing. So you still will get your dental caries if it's not clean off every day.
How about flossing? Is it advisable also for the children?
Once the molars come out, and it's about 2.5, then you develop that contact between the 2 teeth. Yes, and then we do advise flossing at about 2.5.
If you can't see the surface in between the teeth, then you floss.
Then you floss, just like how adults do it. No?
And then they develop
Parents
that
will do
habit again.
Okay.
Up to adulthood, if they are used to flossing. Admit it, a lot of us don't floss, right? So we develop that
You have
habit.
to remember it, your toothbrush, and then your dental floss, and then your toothbrush.
You say you floss the teeth you want to keep. You brush the teeth you want to keep. So
Floss, brush, how about mouthwash? Do you mouthwash the teeth you want to keep?
mouthwash is just more of an extra thing. Sometimes some mouthwashes have fluoride, so you have an extra boost of fluoride. But it's not something that needs to be in the staple, brushing, flossing, and your fluoride toothpaste. But you can if you want. You just have to take note that, children develop their spitting at a certain age. So you advocate mouthwash for older children that can spit so they don't swallow the mouthwash.
Okay, now doctors, let's go to dental problems that your kids might have. When the bottle or the nipple of the bottle stays too long in the child's mouth,
Actually, the
could cause
problem there is
cavities?
really
What's inside
what's
the bottle.
inside the
The bottle,
bottle, okay?
yeah.
Because
and the bottle is tilted Diba? They watch
so
TV.
tuloy
or-
the milk. What's the problem is if they fall asleep with the bottle. Because when they fall asleep with the bottle, then that's the infant formula is sugar. Okay, so you gotta take all that out before they fall asleep. If it's water inside that bottle, then that's another story. That's okay. Because a lot of
That
parents...
won't cause tooth decay.
Yes,
Water is
not
no
at
sugar.
all.
No sugar.
Unless you put sugar in the water, then you're in trouble.
Yes, yes, it will. But a lot of parents tell us, she can't fall asleep without the bottle. Then that becomes the problem, and that's what's the problem in the Philippines right now. Because they feel that if they stop giving the bottle at night, and the kids won't fall asleep. So we actually advise weaning at about age...
A year and a half, really.
Yes.
All books will say
From
a year and a half,
But
no
weaning
more
from the bottle, not from
Yeah.
the milk.
Because you can
You can do a sippy cup.
and you can have milk throughout the day with your
Yes.
meals. It just became a habit that they use it for falling asleep. So that's where the problems start.
Can lead to baby bottle tooth decay.
Yes.
And baby bottle tooth decay starts with cavities developing in the front teeth, because the front teeth are the first ones there. They're the first ones to erupt. The bottom teeth rarely get cavities unless it's super severe, because your tongue is there to cover it. And there's more salivary ducts in the floor of the mouth, and in the top it's more dry. And if you don't brush well, so you have all the plaque, and then you leave the milk in the mouth, and then the child sleeps 10 hours, 8 hours, and it's just sitting there. So it has time for the bacteria to produce acids, eat away at the tooth, and then eventually you get your cavities.
So that's one cause of dental problems for children,
Yes.
no? Baby
Yeah.
bottle, tooth decay.
Yes.
How about, we've been talking about cavities. Help us understand how do they form? What are the first signs that the parent should watch out for?
Yes. You know, the cavities, as I said, are really caused primarily by bacteria. When the bacteria is in there, the problem is when the child eats something sugary or something that can be fermented, then the bacteria will start producing that acid, and that acid will rot away on your teeth. Now, it's something that is chronic. It's not something that it will happen overnight, but with repeated and constant practice of sugar and that bacteria in there, then it will really melt that enamel and dissolve that enamel.
Wow.
Yeah, so at first you'll see them to be white spots. You'll see like
And the white spots
chalky
right
white.
near the gum line.
Okay.
So, because like Fina said, dental caries or tooth decay doesn't happen one day. It's like a big dark hole. It happens gradually, and at some point, you can still replace the minerals that you've lost, and then your
Reverse it.
cavity doesn't progress into a
If you
hole,
catch
or a
it
tooth
early
decay
on,
doesn't
yeah.
progress into a cavity, because a cavity is already when it's a hole. But if you know the bacteria is allowed to keep dissolving the tooth, then eventually you'll get a hole, and then you have your cavity. That's why early childhood caries, which is dental cavities that you see on children below 5 years old, and the average is usually 2.5, 3 that really have a lot, is smooth surface, meaning it's on the surface that really shouldn't store any food.
Yeah.
And like if you get cavities on the chewing surface, you're like, oh, because it gets stuck there, and then you
There's
can't.
more reason to
Yeah,
justify
but on the
there's a
smooth
cavity there.
surface, there's nothing there that will keep the food. So there's something that's going on that is creating these types of cavities. And typical is really the front teeth that are, it's like peeling away of the layers of the tooth.
And you don't want that to happen, no? You
Yes.
don't want it to reach that point that
You
there's
don't
a
want
hole,
that to
it's
happen
peeling
because
away.
then pain will start, infection
Okay.
will start, okay? Now, the problem with that is since tooth decay is bacterial, then you have that bacteria in there, then it causes more problems systemically also for the child. That bacteria can spread. It's an infection on the head because teeth is located on the head, right?
Yes.
So it can spread throughout your heart. The bacteria can go to the
It's
heart.
just
to the brain.
infection
It's
and
an
bacteria,
infection.
so you don't want that.
I don't think a lot of people really take note that when you have a problem here in this area, it can affect
Yes.
your general
yes.
well-being, no?
And primary teeth or baby teeth are often neglected because they say, oh,
It's just gonna fall
fall
off.
But you need your baby teeth for chewing, for
Yeah.
eating,
For
for
speaking
growth, for
even, no?
speaking,
Yeah.
for smiling. Some
Yes.
children get so shy because they have bad front teeth, and then aesthetics now is so. Everyone wants to see nice teeth, and children are so curious. They're always like, "Why are your teeth like that?" So the other kids get a little bit
Get
insecure.
bullied, yeah.
So,
They can get bullied because of
yeah,
their
so it's not just baby teeth.
and malnutrition.
Yeah,
Because
they can't eat.
They refuse the hard food, and that's your meat. They'll just eat soft food. That's something they can just swallow.
That's why they can't stop the bottle. Because then it's easier to drink. And also missed days in schools, toothaches. You have to pull them out in school. And, a young child, again, will not just sit and, open for a dental treatment. So it's very difficult to have to treat a child. And, if you could just prevent it, then all the better for the child and the parent. They don't have to go through that stress.
Who's at risk? Are there any risk factors for a child getting tooth decay or cavities? You've mentioned that it can be passed on from the parent to the child.
Yeah, so that's a risk factor if you're the mother or the caregiver has active
A lot
caries.
of
Yes, a lot of
cavities.
caries. Yes, there's a lot of risk factors, especially for the Filipinos. A risk factor is when the child is put to bed with a baby bottle, especially for our below 6 years old. Yes. And for above 6, those who snack often, those, at will.
Diet. Diet still plays a lot a role in dental caries, tooth decay development. Or
Tooth decay kasi is multifactorial. It's not caused by one problem. It's a lot of problems put together.
Okay.
That's what I think our parents should understand.
Yeah, and that's why they say, oh, I brush naman. Why still? Because it's different. You may brush, but you're like, you know, loading up or sleeping with the pato, so you still get
Even
your
if you
dental.
brush your teeth well,
Or
2
you're
minutes.
brushing, but you're not using fluoridated toothpaste.
Yeah.
Okay.
So there's nothing there. You have your fluoride free. Oh, because then they're gonna swallow the toothpaste. You know, you have, again, you can swallow a certain amount of toothpaste. It's why you give your toothpaste as, you know, the amount you give is as the child gets bigger. You don't give the whole tube of toothpaste every time, right? So as they grow, smear to a half a pea to a pea size.
It's really monitoring
Yes.
how your child brushes his or her teeth, the amount you put in the toothbrush.
Fluoride. And we're talking about fluoride toothpaste that is in the concentration more of the adult toothpaste. Because then the children's toothpaste, most have just half those, like 500 parts. The most effective is 1,000 parts of fluoride to 1,000 for up. But the kiddie toothpaste that are made for kids with all the flavoring is like 500, 600 parts. So you don't get that effectivity of the fluoride. Now, what does fluoride do? It makes it harder to dissolve your tooth.
Okay. It's like a protective layer for your
It's
tooth.
harder to dissolve it, so your cavities don't progress quicker.
But in the event that your cavities progress, there are dental procedures that can be
the
given to these
treatment comes in.
children, the treatment. And we'll talk about these dental procedures, these treatments, when MedTalk returns. We're back here on MedTalk, still talking about child dental health. You may join in the discussion by calling our hotline at 548-4678. Doctors, now let's talk about dental procedures for children. Let's first talk about stainless steel crowns. Akala ko sa adults lang yun. Meron din pala for kids.
Crowns are actually more like it's more like fillings lang naman. It's not
okay.
like you know, like that. Yes, it is supposed to protect the whole tooth. That's why. And for children, because especially if they're very big cavities, we'd like to protect the whole tooth, and the bacteria doesn't have any chance anymore of going inside and doing a problem. What we want for the kids is when we do a procedure, we won't
Have to redo it again.
go back to it.
Right,
Because when the filling comes off, we just have to put that back in. And it was so hard to put it there to begin with. So we'd like to put something like semi-permanent until the permanent teeth comes out.
So stainless steel crown is basically a full coverage restoration. So it covers all the surfaces of the teeth. Like Fina said, it reduces the risk of a cavity developing again in the same tooth.
Okay.
So it stays there until the tooth is replaced. So it basically is cemented onto the crown part, and the roots are still, you know, there. There's the next tooth, the permanent tooth will just push it out, and then you have that for the tooth fairy.
Oh, okay. Yeah, the tooth fairy.
That's the one.
When is this necessary to put a stainless steel crown, and at what age?
Only when you have a very big cavity.
Yeah.
Only when it's indicated. We won't put one when you don't
Yeah, when
need
it's
one.
a multi-surface cavity. Like I said, teeth have 5 surfaces. So if you have more than one area, or one area that's usually in between the teeth, so you want a restoration that will stay. So you put it, and you put it whenever the tooth needs it. So whether the child is a year and a half, if they have molars, or 2,
Already
or
at
6.
a year and a half, you can have a steel crown already.
Yeah.
Well, you can have a cavity, as you've mentioned, no? Basta you have a tooth, you can have a cavity.
So, and you know, it lasts until usually the stainless steel crowns are placed on molars.
Okay.
So the molars come out at 10, 12
Years old.
So years old. So you
permanent.
have to keep it there. So if you're putting it on a child that's 3, then at least that restoration will last until the tooth comes out at 10 or even 12 years old.
The tooth is protected from
Yes.
further damage.
Yeah. And it's less maintenance. Now, there are white full coverage, but they're more expensive, and
That's still the
they're still
crown.
available.
That's
Yes,
still
but
the crown.
white.
White.
Yeah, we call it veneer.
Okay, aesthetics na
crowns.
ba yan?
Yeah, more aesthetics. It depends, but there's still some pros and cons with it.
Okay.
It's expensive, and sometimes it can fracture and break. Unlike a stainless steel crown, this is more malleable, so it can withstand more pressure from the chewing. More
So
forces.
stainless steel
Okay.
is not as expensive as
Yeah.
the white colored
For the
for the
molars,
molars.
crowns.
How about tooth fillings? When is it necessary? Is it expensive? And when does a child need to have their tooth filled?
You know, some parents think that if you put a filling on a child, it should be cheaper than if they have their own filling.
Kasi
Right?
mas maliit.
Kasi feeling
What's the
nila,
thinking
baby
there?
teeth
What's the
eh.
thinking behind
Diba?
that?
So, ang expensive naman ng dental treatment na to. Bata lang yan. Then that becomes, the parents should understand that we're using the same thing. So your filling is what we put on the child. And we're using the same instruments, we have even more instruments on the child. So we put a filling when we feel it's indicated. We consider the risk factors. If we feel it's an active caries, meaning it will do more damage to the teeth, then yes, we put fillings right away.
And the one thing that's different from baby teeth and permanent teeth is baby teeth have thinner surfaces, thinner layers, and bigger nerves. So a small cavity can immediately cause a toothache within 3 months or before 6 months because the layers are so thin. So it can get to, from just start to the second layer, which gets more sensitive to the nerves. Unlike permanent teeth that have thicker and the layers are probably less porous. So if you do have a cavity or a toothache in a permanent tooth, then it's really because of neglect. But kids, it's really the structure of the tooth and its ability to just break down so quickly.
And each child has a different, how do you call that? Parang the hardness or the toughness of the tooth. Each child is different,
Actually,
no?
some teeth, they say that if your child is more premature, because then primary teeth develop in the stomach, in utero. So sometimes if there's a disruption, then your primary teeth don't come out as well as normal. So it can sometimes affect, but mostly it's really just care for the
Okay,
teeth.
it all boils down to the care.
Yeah,
Whether you're premature or you were born on time, basta it's the care of the caregiver, that should be a primary concern when taking good care of your child's dental health. Is there a disadvantage to tooth fillings? You've mentioned the advantages. How about, is there any disadvantage to that?
Well, I think the only thing difficult about tooth fillings is putting it in the
How to
child.
put it there.
That's the only okay.
Because then,
And making it stick there.
Because if your child has like a lot of dental caries, if a lot of tooth decay, lots of teeth that needs to be filled, and you're talking about a 2.5-year-old child, then usually it's more of needing to sedate the child, putting the child a little bit to sleep, to just be able to work on everything. Because definitely they're not going to sit and open their mouths for longer than 30 minutes at a time. And especially when they're feeling already different sensations of like numbness or taste, and they get they're not very happy. So
that's
so
true, and
it's the
that's when they
best.
get traumatized. No, that's when they remember that I don't want to see my dentist.
Yeah.
Yeah, or when they come and they already have a swelling, then it's harder.
In your practice, before we go to extractions, how do you appease the child? Let's start with Doc Fina. How do you appease the child when he or she is in your clinic and maybe throwing a tantrum already or very uncomfortable already? What do you do? Do you sing to them?
It depends really on the age of the child. An infant, like a 2-year-old, of course, the logic reasoning is really not there. So we just say, oh, we're going to count your teeth today. It's really more of conditioning the child in your reception area before they go in. So we tell them what's going to happen first, and you got to stick to what you say.
Okay.
So if I say I'm just going to count your teeth, I'm really just going to count the teeth. I'm not going to put any fillings there, right? it's really more of conditioning and letting them know what to expect when they enter the operatory. And of course, it helps that you have a child-friendly clinic.
Yes.
Yes. And that there are no other children crying.
Kasi hawa-hawa yan. If one cries, they're gonna cry and they're gonna storm out of your clinic.
Yes.
And parents also should realize that children are not little adults. Some parents will come in and say, my child has cavity, do everything. You know, you have to understand that children, you know, they have short attention span. They'll only sit a little bit. You have to introduce, you know, sensation, especially the ones that are still on the oral stage, the younger ones. They use their mouths are, you know, that's why they stick everything in their mouth, because that's what, you know, they learn through it. They, you know, feel through it, and you're trying to invade it. So, and the stranger coming in. So parents should realize that, you know, it takes time. You shouldn't demand that, okay, do everything at once. You should, again, realize that, you know, some children are shy.
Yes.
Some children are, you know, let's go and do everything. So each child has a different personality, and so you can't treat the child the same way. And parents, you know, you can't say, you know, just go and sit, or why is my child crying? Because it's different. And so you want to do little things at a time, you know, something easy, something quick, before trying to get into the harder parts like filling and restorations. Because, you know, some children, they'll be okay for, you know, brushing and cleaning, and then they'll be fine. And then the parents will say, oh, can you fill it na red? Like, wait, they're already tired. When you start, they're already off the door. You said you're only going to brush. And then, so, you know, it's really how the child is. You said you're only going to brush. Now you want
just
to fill,
going to
then they're
count
going to
my
be,
teeth.
then
And then now you're doing something already.
Then they're going to be upset. They're not going to believe you. They won't want to come back because you said, and you didn't follow through with what you said. So children are like that.
Your tactic, Doc Georgia, what do you do? Do you say we're going to count here? Do you sing? How do you appease the child?
Again, a friendly environment always helps, but the reception area is always child-friendly. I always tell the parents, you know, when you visit me, don't say, oh, we're going to visit the dentist, it's not going to hurt. Why would you? It's like, okay, we're going to the mall, it's not going to, I mean, you know, you have to condition
You introduce
like,
the word hurt again there.
and they're already curious why. So, you know, you're just going to visit the dentist, you'll count your teeth, you're going to brush and see. And that's it. Diba? So, parents really have to not, their fear should not be
transferred to the children.
Okay, parents, remember that.
We have some parents like that. Sila yung mas
nervous.
Yes, they're very nervous in the clinic, and they're no, don't worry, it's not gonna hurt, it's not gonna hurt. So, you know,
and they're always like, oh,
I can't
what if my
look, I
child
can't
cries? It's okay, you know. If they cry, we'll see why, and then we'll try and adjust or do something.
Do children go through life with cavities? Talagang it will happen to a child that they will have cavities.
No.
Not everyone. Not everyone.
Okay.
Yeah, with the advent of your, like I said, all this fluoride and then fluoride at the dentist, you know, some kids are already old, graduated by clinic with no problems at all. So that's what we want.
We have a lot of those. Happily reporting that.
Happy to know as well. Not on a happy note though, extractions. Before we cut to a break, now when does a child need for his or her tooth to be extracted?
When it's really not savable, then it's really gotta go.
Okay.
Because it can cause more problems. Infection, as we said,
Swelling.
abscess. We don't want that, diba? So we gotta take them out so it will stop causing problems in the mouth.
Yeah. And so when a tooth needs to come out, whether the child again is a year and a half, it don't need to be taken out. You don't wait until they're 6 to take out something that's been sitting there for so long that needs to really come out.
That's why it's important to have your dental checkups. How often should the child be brought to the dentist?
Depends on the caries risk factors of the child. If we label the child to be a low caries risk, meaning she's not prone to cavities, then we can see the child every 6 months. But if the child is high risk, meaning she's very prone to tooth decay, because we've seen the risk factors that we were saying kanina, we see risk factors there, then we'd like to see the child every 3 months and monitor those starting cavities and all that.
We will talk about how to take good care of your child's teeth, how you can be a good caregiver to avoid the cavities and the other dental problems your child might face. We'll talk about that when MedTalk returns.
According to the Department of Health, only 70% of the Philippine population visit the dentist regularly. In fact, 97% of Filipino children 6 years old and below have cavities.
We're back here on MedTalk, still talking about child dental health. Doc Georgia and Doc Fina, any last message to all our viewers on prevention, on taking good care of their child's teeth, and how often should they see you guys?
Yeah, all right. We want you to visit, you follow your dentist recommendations for your children. We want you in at, before the children turn 1. And we'd also like, if the dentist says come back after 3 months, please come back after 3 months. Not after 3 years. So we have some patients who are like that.
Okay.
Because we'd like to monitor, because remember, dental caries is a preventable disease. It's something that you can prevent from happening, prevent the pain, prevent the infection. And what else?
Well, again, like Fia said, it's a preventable disease. And because you deal with children, it's really up to the parents and caregivers. The child is not going to say, oh, take me to the dentist or brush my teeth. So it's really the parents' responsibility for keeping the child cavity-free.
Okay, so we want a cavity-free Philippines.
Yes.
But before that, we start with a cavity-free home.
Yeah, so brushing twice a day, 2 minutes usually, but you really just want to make sure that you get all the surfaces clean, using the right amount of fluoride toothpaste, so from a smear to a pea size, depending on your child. And we're talking about the concentration of 1,000 parts of fluoride to 1,400, which is usually found in the adult toothpaste. So they'll complain, but you know, just a little bit, then wipe out the excess or spit out the excess.
Okay.
There's some parents who say we don't like the anghang of the toothpaste. So there are some kitty toothpastes out there that have the 1,000. So you just have to look at the box.
Okay.
It's really 1,000.
Always read the label.
Always read the label, yes.
So does it necessarily mean you can share your toothpaste with your child?
The toothpaste, yes, not the toothbrush.
Kasi cavities din yan. Because if your child likes the variant of your toothpaste, then
no problem.
And don't make your child fall asleep and keeping the bottle with milk or anything with sugar throughout the night.
Any foods to avoid? Or what should the child take more of?
Of course, we always want our fruits and vegetables in, right? But of course, sometimes choosing the snacks can also be a thought, because we like to veer away from biscuits as much as we can, because biscuits retain on the teeth and they're very hard to remove, especially because of the grooves of the teeth. When they get in there, it's hard to brush it out. What else?
Frequency.
Of course, yeah, the frequency of snacking.
Snack on a fruit.
Snack on a fruit, but sometimes some children snack more than 5 times a day.
Okay.
So we like
growing kids.
Water,
yes.
water.
And yes, follow up with water and water all the time. Soft drinks, juices are very high in sugar, even if they say they're healthy, but you know, it's really sweet. It's liquid sugar. Yes.
Pediatric dental care up to what age before we go?
21.
Okay.
And at any age,
21,
actually any age if there's
and
special kids.
if you're a special child with
we'll
healthcare needs, then we
take you in at
see
any
you.
age.
Okay, yeah, until we get old.
Well, thank you very much, Doc Georgia and Doc Fina, for taking care of our dental needs via the information that you've passed on to all of us tonight. Maraming salamat.
Thank you for having us, Angel.
Thank you. We'll see you again next Tuesday, 7 p.m. here on your scheduled on-air consultation on 9 TV. This is Angel Jacob. Good night, everyone. Don't forget to brush your teeth.